Everybody. Hope everybody's well. Dr. Gupta is with us today too, and you'll hear from her in a little bit. Sadly, we lost a member of the community over the last 24 hours. She was 71 years old. Certainly want to think about her family and all the families of those who have lost loved ones. We've lost 673 residents in this pandemic directly related to COVID-19. So again, very tough every time we lose a neighbor. Looking at the positive rate, the 7-day average is actually down today, 0.8%. Overall, we've seen positive rates stabilize. Our 14-day average and 7-day average are right around the same. That's really good. That's consistent. So we're doing much better than other communities in New York State, and if you compare ourselves to areas across the country, we are blowing them out of the water. That's really because of the hard work of the community, all of the leaders who have been fighting the response. So congratulations to everybody on our success, but we still have a little bit of ways to go here, so we can't get too confident. Active cases down to 557. I think that's the lowest we've been in a period of time. Again, the more daily cases drop, the lower the active cases will be from the 10-day quarantines. Hospital numbers have stabilized, continue to drop each week a little bit. We have 51 residents in the hospital, and we have 8 residents in the ICU. Please keep those 8 residents and those 51 residents in your thoughts and prayers. Looking at the cases today, we have 79 new cases. We've had 31,807 positive cases, confirmed positive cases to date. Overall, caseloads have stabilized somewhere between 50 to 100. Some days we'll go a little bit under 50, but when you consider where we are, we're indoors. Our positive rate under 1% today. Overall, doing very well. Vaccinations. Today we'll go over 100,000 vaccinations in our community. I think we're going into today, we're almost at 99,000. So that's all county residents going to all available pods. To give you an idea, 100,000 residents is about 28% of the adult population. And so we're making tremendous ground picking up our vaccinations. We'll vaccinate 7,000 people in our vaccine week this week from this Wednesday to next Tuesday. So again, that's just us. We've seen recently the state fairgrounds, let alone the capacity they had to begin with, will be a site that is operating close to 24/7 as they will receive a lot of Johnson & Johnson supply in as well. So lots of opportunities to get vaccinated. We are seeing that we are making serious inroads in eligible populations. We've been working with educators. We've been reserving slots. This week we reserved a certain number of slots, and we would have given the educators more slots. We were not able to fill the slots. So we think we're doing really, really well with our educators to the point where we may be getting to capacity. Some people, remember, just aren't going to get vaccinated right now, and that's just the reality. In addition to that, we opened up at the county level for our county pods, hotel workers, restaurant workers. Restaurants, it's a broad category. If you work in a fast food chain, if you're working at Dunkin' Donuts, if you're working at McDonald's, any of these, that's a restaurant. You qualify. We want you to get vaccinated. Please take advantage of it. Go online. That's important. We continue to work with our New American community partners to get the eligible members of the New American population vaccinated as well. We continue to work with our partners in the community for pop-up clinics. I believe tomorrow we'll be at Tucker Church, Reverend Draper. I want to thank County Legislator Vern Williams, too, for helping out, and certainly our partners at City Hall, Mayor Walsh and his team as well for working with us on this. we know about the process. We know that the mass vaccination sites are very effective to get shots in arms the fastest, and that's how we're going to end this pandemic very quickly. But we also know we need to get vaccine to all members of the community, and we know in certain communities this method of distribution isn't the best. So we'll continue to be intentional with pop-up sites. We continue to analyze data, not just on city zip codes, but rural zip codes as well. In the event that we need to go target some rural communities, we will. And so we're tracking this to make sure that we are getting everybody vaccinated who wants to be, and we're making sure that there's not one geographical area or one area of the community based off of ethnic background or race that's lagging. Again, all intentional. Tuesday, March 9th, we're going to have a senior over 65 clinic. With OnList, we put that out. So for folks who are on OnList, please check your emails. We believe we may be done with OnList very soon. We may even be able to be done with OnList this week because of every time we have OnList appointments, say we have 200 slots for OnList that day. For us to get 200 slots, we have to contact 600, 700, 800 people because so many people have gotten vaccine elsewhere. So again, this is a good sign that these demographics, I think, are really, we're getting to them. We're getting to our seniors. In addition to that, we have received some Johnson & Johnson vaccine. We'll work with homebound seniors. We'll work with our partners that do homebound care and get to these residents with the Johnson & Johnson, which is a single shot. So certainly right now on the vaccination front, when you look at what's going on with the pharmacies, you look at what we're doing, you look at what's going on at the state fairgrounds, we're on offense, and it's a good feeling. We're making substantial gains, and as we do that, the community will build up immunity, and we'll see the caseloads continue to drop and the positive rate continue to drop. Testing, again, want to reiterate the way we have bumps in the road now is symptomatic spread. Please, anytime you have symptoms, you need to rule out COVID. You're on Team Onondaga. We're all one family. That's how we do this. ongov.net/Cayuga Medical. Register 9 to 1 Monday through Friday. Weekend testing. We're now pivoting here to Upstate is going to do weekend testing now for symptoms at Community Hospital, 11 to 4. And you can go to mychart.upstate.edu to register for symptomatic weekend testing. Asymptomatic testing continues. Today, again, we typically have testing sites here at the On-Center during the week when demand is low. We don't do it 7 days a week, but we still do it. And then we go out into the community, and then we work with school districts. Onondaga Town Hall today, Lafayette Community Center tomorrow for the testing. Good news related to our friends at Syracuse University, the stadium. We were able to work with Syracuse University and the state of New York to come to some common ground on testing protocols. We're happy to do that, and we're happy that season ticket holders and students will get the opportunity to watch the lacrosse, men's and women's lacrosse teams, and so that's positive. This pandemic, it's almost been a year where we've had cases in this community, and we've been at work on this pandemic much longer than this, but it's been a long year, and it's been traumatic. Mental health has been a serious challenge for everybody. So getting back these small things where people can be distracted and entertained for a while matters. Speaking of mental health, there is certainly more and more evidence compounding on what is happening to our kids related to this pandemic. And when you look at mental health visitations to hospitals, all the data now is showing that in 2020, you saw 25 to 30% increases with young children and children year over year from 19. When we look at the fact that we know we're not, even though our educators are doing everything humanly possible with these hybrid schedules, we know our kids are not doing as well. And we also know we have serious problems with addiction, with opioids, suicide right now, and this is all pandemic driven. So what we've done in this whole process is we've always based decisions on data, not political pressure. There's a lot of political pressure related to schools, whether it's parents advocating for opening or some groups concerned about opening. So it's important we find our balance as a community. In the beginning of this process, when we went back to school, school districts had the opportunity to develop plans and to get feedback from all the stakeholders being the workforce, the parents, and giving the parents options for in-person learning or remote learning. They developed plans based off of the facts on the ground at that time. Here we are on the backside of the pandemic, and things have changed. The facts on the ground have changed. We know more about the virus. Specifically, we know more with our testing data about transmission, when it happens, where it happens, how it happens. In addition to that, we have vaccinated 28% of the adult population right now. That if you broke down, I don't even know the eligible population, but that percentage would be much, much higher. So when we take all these factors in, we were approached by school districts about looking at the 6 feet to something less than 6 feet for physical distancing. The reason that is because based off of their plans originally, they could have did something less than 6 feet, but they didn't. And why they didn't for most cases was back when these plans were developed, the thought process was that children would not wear masks because it would be a change, it would be difficult. What we now know is that children are very good at wearing masks. And so the districts put into their plans desks 6 feet apart, because if you, at the time, if you were 6 feet apart, the child did not have to wear a mask. We changed that later on, and we worked with districts to make sure all the kids were wearing masks. So we were asked to look at this, to reevaluate it. What we have reevaluated. Dr. Gupta and her team spent a lot of time looking at this specific issue based off of the facts on the ground. What we have come up with is guidance. The final decision of how to implement the guidance, or if you implement the guidance, will be the school districts. But at this time, Dr. Gupta, and I'll have her come up in a minute to give more background, but at this time, Dr. Gupta has recommended to me, and I feel confident in her recommendation, that it is okay to go from 6 feet to something less than 6 feet if there is a physical barrier. So if you have some sort of partition. So recognizing that the partition is something that will have a cost to it, the county will pay for the partitions for any district that needs them. We know that some districts already have them. We'll take an inventory if folks, after reviewing the guidance, think they want to go to something different than their existing plan. How many partitions would they need? We'll pay for it. So that's not a barrier to modifying their plans. I'll ask that Dr. Gupta comes up and goes through everything, but certainly we still want to see testing programs in the schools. We want to analyze the data. Everything is fluid. We certainly reserve the right to encourage the districts to work with us if things change to adapt, whether that's either way, if things get better or things get worse. But again, this will be a school district decision. We are giving guidance based off of the data and on the ground here in our county, in our buildings at this moment in time. So saying that, I'll ask Dr. Gupta to come on up and kind of talk about her process and coming to this recommendation. Doctor?
Good afternoon. I think you all have been very anxiously waiting about this policy proposal, and it has been quite a bit of journey. We will be almost a year when we had our first case announced on the 14th floor conference room on 16th of March that we have COVID-19 case. And just to think of the background, it has disrupted everything, like including in-person learning in the United States, with approximately half of all students are doing online instructions. And based on our survey, it was true in our community also. It varied from school to school, but if you take an average, that seems like a true finding also. Discontinuation of in-person schooling has resulted in many hardship, especially which disproportionately affected families of lower socioeconomic status. The negative impact hits hardest a lot of more. So if you look for the United States, more than 6 million special education kids. And if you look into the New York State, almost 500,000 have the special education. They are in the special education in our own Onondaga County by the New York State Department of Education, about a little bit over 10, almost 11,000 kids who are reported as students with disability. So just to remind just the timeline, as I'm going through my process in putting a policy proposal that helps all of you to understand that. Go back a year, January 30th, WHO declares a public health emergency. 31st, then Human and Health Secretary Alex Azar declares public health emergency United States. February 11th, we know there is a virus which is called severe acute respiratory syndrome virus, SARS-CoV-2, that's came out, and the disease is called now coronavirus disease COVID-19. March 7th, Governor Cuomo declared a state of emergency in the New York State, and March 11th, WHO declared a global pandemic. March 14th, our own county executive McMahon declared state of emergency in Onondaga County, and all the schools were closed, ordered to close on 4 p.m. on March 20th. So it's almost a year, and a lot of has happened since then. Rigorous public health measure, lockdown, all those things have flattened the curve. You can see that, box the virus essentially with the testing, tracking, and isolation, quarantine. All the mitigation processes, including now, which we are so proud of, is the vaccination efforts in our community. However, despite the community transmission, we also remember that we did not see local transmission within the school. So that is important to remember, that what was happening, if you look at the curves and like a case curve, cumulative data, the kids stayed at the lower sort of a curve in that one. Here in Onondaga County, schools adopted a hybrid model of learning during the fall and winter season, with few parents studying just online, with some were hybrid and some exclusively in person. I was actually very happily surprised to hear that some students were able to do that. All of this, but however, it has been sort of a nightmare for both students, parents, teachers, school administrators, and public health officials like ourselves. And research has shown that disruption in schools, children's schooling is globally detrimental to their learning, social development, to child and adolescent. Basically it's impacting them. And I will use a quote of American Academy of Pediatrics, which does not need to be modified, which is very powerful to see that how the policies are created based on what the information comes out from review of literature. Schools and school-supported programs are fundamental to child and adolescent development and well-being, and provide our children and adolescents with academic infrastructure, either in person or virtually, social and emotional skills, safety, reliable nutrition, physical, occupational speech therapy, mental health services, and opportunities for physical activity, among other benefits. So beyond supporting the educational development of children and adolescents, schools play a critical role in addressing racial and social inequity. This is quote unquote from the American Academy of Pediatrics. This position paper came out in January of 2021, which is very important. And according to Center for Disease Control, mental health-related emergency room visits actually in the pediatric population quite a bit from March till October, including in our own community. So what we came out with a policy proposal to bring more children to the classroom by one thing, look at that, what is the barrier? One of the biggest barrier thought, okay, you have to have a 6 feet between the students. That limits how many kids could be in the same classroom, in the bus rides, in the lunchroom. All these things had to be there. And that was a necessity at that time because we didn't know anything about the virus. And in a year, we have learned quite a bit, not all, but a lot more. So what we are putting forward a policy proposal for K through 12 to bringing more students back into the classroom for in-person learning by adopting a policy by reducing physical distance between students from 6 feet to less to 3 feet. As a result, school district will be accommodate more children in the classrooms. And what also remember, there are certain nuances which we also want to remind that physical distance between teacher and staff and student, all those things, certain things which we will still have to follow. We want the adults to stay in 6 feet if they're in staff meetings and all those things, and if possible, from the students as well. And school will have to see, as county executive has mentioned, that is that something can be applicable to there, and are they willing to do that? One of the very important part of this policy proposal is that you have to, a prerequisite for this policy proposal, every school will have to continue to use their existing non-pharmacological intervention, what we call NPI in a short, of hand washing, mask, staying home, temperature check, and all those things which are there. Nothing is going to be replaced. You are adding this to that because those policies with the physical distancing of 6 feet have made an impact. We saw that kids did not have any more infection within the school rather than when they were online. We literally have that data in our own community. So that was the very comforting for me to see as a commissioner, that I feel very comfortable. How did we come out with that? We have to look at what are the supporting evidence? How can I say that I feel comfortable? Because this is first at this point, at least in our state. We kind of have to based on certain criteria. So when you look at the World Health Organization, WHO, they use that a decision to open or close the school could consider on 3 factors. We sort of took the same guidelines and say, okay, what are we going to look when we are looking for policy proposal? We are going to look, one, what is the current COVID-19 transmission and severity in children, which we saw that we know by the data at this point. It's no different when they're doing online, staying home, or when they're out with their parents, not doing any other thing coming to school versus when they are in the school. And also we have seen throughout the state and through the actually with the review of literature from the international data. Number 2, local data, right? Important local epidemiology and transmission situation of COVID-19, where schools are geographically located. So we have seen that, which is something we feel comfortable at this point. And number 3 will be, what are the capability of each school to maintain COVID-19 prevention and control measures? And I can tell you that I have had several meetings with the superintendents at different time intervals, from initial meeting of anxiety in their mind to comfort and confidence, and they are there to take care of their children and staff alike. And that is very important because I feel very comfortable that they will be continue to work with us in making that, and also with other stakeholders like parents and staff, to make that happen. We came to the conclusion based on how we are going to satisfy all these 3 of our own requirements by reviewing a lot of literature to prove that there's a low risk of transmission in any community, whether it's here locally or it's in Wisconsin or it's in Italy or in any place else. There is a plenty of literature about that. At the local level, we certainly saw an observed decline in the number of cases in Onondaga County without any evidence of COVID-19 transmission within the school. I'm sort of repeating it just to remind that. And also, if you look at the current New York State testing data, which shows the 7 days positive rate of less than 1%, it fluctuates depending on, and as County Executive was mentioning, we are hovering around. Sometimes we went out to 40, then we went up a little bit. It just sort of fluctuating at a little bit, but we are okay at this point. So with this sort of, without going into too much of the details of every research study, which I have compiled it and had discussed with my team, is that something we are going to put forward in a much more formal document in the near future. The key part will be, this is the policy proposal, how is it going to be implemented? So we give guidance, which is very important, is that how the school is going to do. So in-person school for K through 12, all the schools will require intense preparation. It's not going to happen tomorrow. It's not going to happen on Monday. It will require a lot of thought process, discussion with their stakeholders, and then come up with discussion with us. We are going to be there along the way, right? A school can take any kind of approach. They can take graded approach. It means you can go by grade. You can do elementary school, you can do then middle school, then you can do high school, or depending on, you can do the whole school together, depending on how comfortable you are, how your resources are, or how your stakeholders are willing to participate in it. The other things, so some of the suggestions, I am very advocate of the seat assignments, because it really helps in case investigations and contact tracing, and it gives comfort that who's sitting next to you. Lunch seating, bus transportation, all these things will be a lot of discussion. They have been discussed when we did some focus group with some superintendents. Physical education class, all these things, and adults in the school setting, we would still recommend try to maintain the 6 feet distance, because adults is different. Adult infection rate is different than the children. So we would ask them, if they are in a staff meeting and all those things, keep those. And even in the classroom, if they possibly can maintain that, that will be important also. The good part is that a lot of them, many of the teachers are vaccinated and continue to be vaccinated in the future. Physical barriers such as plexiglass between children, at this point we are requiring, because we want to take a baby step to go from 6 to 3 feet, not through all the, everything shouldn't be done at the same time. And we'll see how the data is, then we'll go from next step at that time. Because it's a choice and option for remote learning, we always should be given to the parents. If the parents don't feel comfortable, they should be able to have that option. How are we going to evaluate that? We'll continue to monitor our data on a daily basis, of course, which I get the information. Follow weekly trend for the new cases in the community and the school alike. We will trend it and see how are they approaching, are they at the same way they were before. That community, when we had the cumulative data, we saw quite a bit of skyrocketing at one point in the fall and somewhat early winter, but the kids' cases sort of stayed not that high. They stayed sort of almost flattened. We also will look at the New York State's COVID-19 data, which was publicly available, which you all, I think, can see, and CDC grade on the weekly basis. And we are working on the public display, like a sort of dashboard or something on our website, so you can continue to go back, so you can get that information. So these are the policy recommendation from us, from the health department. We will continue to work with the school, each and every school district, and along with any stakeholders. Our data-driven approach with the active engagement of the stakeholders will help us actually modify, if any, we need to do policy recommendation in the future. Because no policy should be very rigid. That's a very important part of that. We learn from how the data comes and how we see difficulties or not so difficulty. Every school is unique in their own ways. Every geography, every zip code is unique. So we will, basically our goal is to bring the more kids back to the school, but at the same time, continue to balance the health of the rest of the community. These are not exclusive. They are actually very aligned together. So we'll be happy to take any questions after. Thank you.
I want to thank Dr. Gupta and her team. Obviously, they've done a lot of work, as you can see. and looked at this from every different angle, taking in input from all stakeholders. So the next part of the process is we'll be here as a resource to review the guidance with the districts. The districts then will need to look at what is possible for them, and they'll need to engage with their stakeholders. I think to Dr. Gupta's point, I know parents who may be excited about this news probably want this to happen tomorrow. It can't happen tomorrow. One, we're going to order partitions. That will take a little bit of time for them to get here. But also, we want to do this right. And so by doing it right, you need to work through the stakeholders, address every concern you can. Some of these concerns you can't address because some things are just unknown, and that's just part of where we are. But overall, thank you, Doctor, for all the work you did here. And it will give certainly some new tools to the districts to try to bring more children back into school, which will help all of us in the public. Questions?
Ryan, two quick questions on the school thing. Did Dr. Gupta say we are the first county to adopt this guidance?
Yeah, I think as far as tackling this issue, there are other districts that may have already been here in the state, because that's where they started out in the beginning. But from the standpoint of diving in, being asked to review this and then make a recommendation and formulate the recommendation under what circumstances, yeah, I think we probably are the first.
And with the 3-foot guideline, would that extend to the buses also, and would they have partitions?
Yeah, I think related to buses, you're probably looking at various flexibilities. Remember, part of the, and Dr. Gupta will work through this with folks, but your average bus ride, I believe, is like 15 minutes. Why is that significant? 15 minutes is significant because when it comes to quarantining, and so I believe there's the opportunity to be within the 6 feet on the bus depending on the timing of when the child is picked up. And again, things like assigned seating, these are all things that easy with certain age groups, a little non-traditional in our society for older age groups. It's got to probably be the norm now for a little while. Yeah, I had some conversations with the state and with the university. We came to some common ground on some things. Everybody gave a little bit, recognizing the goal was to be able to take this step forward and get fans back into the stadium. And so we met in the middle a little bit, right? So that's essentially now the surveillance test will be used as a pool on the students. We will now use the rapid test in addition to that. Within 6 hours of the event, 2 negatives get you in the event. So that was some increased mitigation that the state wanted. It was better than a different type of rapid test, which is more expensive, which makes things unfeasible. So we met in the middle there, essentially, and I think it was a good exercise. Yeah, I don't know. So the lacrosse season goes what, till May? Around there you got Memorial Day is hopefully a weekend that we're playing some games in, right? So I don't know. I think a lot of that depends on what happens with the vaccinations and the herd immunity in the community. So the stadium's a big venue. So could you put more people in there and easily physically distance? Of course you could. It's unique, but again, anytime the state can't just look at one venue for statewide policy. They have to look at all venues over 10,000, and you set restrictions from a macro level. But if we continue to vaccinate at the rate we're going, and you get to that 70% sometime before Memorial Day, maybe there's a chance.
And there was some confusion regarding the vaccine. Some
Yeah, so students will become eligible based off their age or their employment on eligibility, right? So if you have a student that works at a restaurant as a part-time job, get a vaccine. If you have a student that has a comorbidity, get a vaccine. The essentially the residence halls are similar to like an apartment complex. So just because you live in an apartment complex doesn't mean you're eligible at this point. But the good news is those students are kind of counted in our 360,000 adults. Probably at this point next week, we'll be talking about having probably at least 110,000 people vaccinated. So I think you're going to see eligibility start to open up sooner than later, and hopefully we can get the students in the spring.
When can we expect to see a formal document with the lessening of the 6 feet? And ideally, I know it takes a lot of preparation, but when would you like to see schools implementing this? A month from now, 2 months from now?
Yeah, I think a reasonable timeline, the superintendent should really talk about that. Certainly they're going to need, just to get the partitions in, it will take a couple weeks at least. So, right, so you're, so that you have that, but there needs to be some engagement here, right? And again, anytime we make any decision in the pandemic, any decision, whether it's restrictive or easing back restrictions, there's anxiety. I'll give you an example. During the heat of the pandemic with some of my workforce, we let people work from home. Not because that's good for our operation, but because that's what we did related to what was necessary for the transmission. Now, for our operation, it makes more sense for us to bring those people back. People are anxious about this, right? It's not a punishment. You know, having people work from home was a temporary decision for that moment in time. That was not what working for Onondaga County looked like before the pandemic, and it won't be what it's like after the pandemic. But that creates anxiety. So for this, you're going to have folks that are excited, but you're going to have members of the workforce that are anxious. So we need to get the data out, get the public health information out. There's two issues. There's the public health. Is it safe to do this? If it wasn't safe, Dr. Gupta wouldn't say, let's try it. And then there's the logistics. Is it feasible to do this? The school districts are going to determine the second part of that question.
What metric or data point would you use to say we have to go back to 6 feet, or if this isn't safe, that's only kids at the school?
Well, I think, again, Dr. Gupta would have that final call, but from myself, who's in a decision-making role in this process, certainly you would have to have tangible evidence that you had increased transmission rates specific to this decision. And again, one of the things that Dr. Gupta pointed out is right now there is not increased rates of kids positive with COVID-19 with in-person learning over remote learning. They're the same. So what does that tell you? It tells you that this isn't happening in the buildings. It's not. That's a fact. In Onondaga County, it's not. It's happening via household contacts because the kids are getting it from the adults or socializing. If it was happening in the buildings, the rate of transmission for kids in the buildings, in-person learning, would be much higher than remote learners. The data is the data there. That tells the story.
How will you continue to test students? What's the plan?
Yeah, so we're going to want the districts to continue to participate in our testing program, and we've told the superintendents that. And again, we're testing thousands of students a month asymptomatically. Remember, the most effective tool you have is the screening, and when you're sick, you stay home with any symptoms. That's the most effective screening. That's the best regulation that we've had certainly at schools. And many workplaces have adopted that and had a lot of success as well.
Going back to Syracuse University, with all these new recommendations, have you heard any discussion about Syracuse going all in person next fall?
I have not. I have not.
All right, I got a question for Dr. Gupta, if you don't
Yep.
mind. Doctor, how are you?
Good, how are you?
Doing well. Just some housekeeping stuff here. So, if I understand this correctly, you want teachers and staff to still stay 6 feet from students and each other when possible, correct?
Yes.
Gym class, students can now be 6 feet apart instead of 12, correct?
Yep.
are districts mandated to jump in on this policy, or as you mentioned before, can they go about it their own way?
Yes, so it's a policy proposal, right? That depends on what are their resources. We shouldn't shove a policy on somebody's throat. That's important. I think people come to accept any policy when they feel like they can implement in a good way, so they can, make sure they're protecting their health and well-being of their staff and the students alike. So depending on what their resources are, depending on what the willing stakeholders are, because the parents' participation is the crucial here. I personally have gotten letters from the grandmothers and mothers and the emails that please open up the school, right? Because they are pleading with the evidence of those things. But some of them also, occasionally you hear that we don't want that. So a lot of it will depend on how the school is ready to have that implemented based on additional support is being given by the county, and based on what feedback they have gotten from their own students, parents, and the staff.
What is the guidance for being in the cafeteria? And the county executive touched on it for a quick second. What is the guidance for buses? Schools talk about buses being a major issue. What is
right. So we had a conversation with the superintendents also in that one is, so the buses, if you look at that, there is a natural partition, especially for the younger kids, is that the bus seats are pretty high. I just feel like, I didn't think about that. When my kids used to sit in those seats, you could hardly see them from the outside. So there is a very clear distinction, and if we put that 3 feet there for them, they can sit in every seat on the. But if there is a ride is short, that's very important, critical part, and they have the mask on, very properly put on there. They have no other complaints. They can, the 15 minutes, if they have 10 minutes ride, they should be able to sit next, not like very close to each other, but it just makes it a little bit of easier for them to get more kids back. So those conversations are happening at this point, how they can make that happen to the students. However, there could be some logistic things for them to figure it out. Which kid lives near the school, right? So how do you have them sit next to this child? It can be done, but those things, again, going back to that, how do they implement? Implementation of the policy is most of the time is a little headache at times, but it has to be thoughtfully done, not in a rush, because you really don't want to make a mistake.
And the cafeteria?
So cafeteria is, if they are going to take the mask off eating, of course you can't eat with the mask on. They could have one thought process, what at least we suggested, you split the kids in, like if you have 3 feet, every other row goes to the cafeteria, and then they have the 6 feet, or you put the partition in between in the cafeteria if there's not enough space for them to do when they're taking the mask off. So in the classroom, you have 50% already now from, they were 3 feet now, so if you take one row out, they actually become 6 feet. And then they already have partition there also. So those are the things which we'll have to continue to discuss as its implementation is evolving.
Last one, I promise. Is it fair to say that you're opting to go with the World Health Organization guidelines over the CDC guidelines? Is that fair to say with this guidance?
So CDC has put it out at this point 6 feet, but they never said that don't do 3 feet. I mean, they're saying 6 feet. There has been multiple, like for example, if you see in the state of Indiana, I think they have implemented it. I think Michigan also has that, some of it. There are places which started to implement those based on what is the transmission is happening, and I'm hoping CDC will come out too. But yes, we have looked international data as well as national, and then policy statements for American Academy of Pediatrics, and there was also a 16-country publication in Lancet, which was pretty much put forward by Howard Chen School of Public Health from Harvard, is that supporting evidence that why it is crucial, because these kids are having very difficult time, and they're going to be so much behind in their academic growth, but their emotional growth otherwise, and it's really taking a toll. So you have to find some balance, and the policies are there to see if you see a problem, you try to identify some good solution based on the evidence. And I did not take it lightly. It's not that You know, I had to think through it, the process quite a bit, look at the evidence and say, do I feel comfortable at this point that can you go forward? And I think one of you were asking that we can rescind it. If something at any point, if we see any problem in the school district or something, and there will be outbreak, there will be cases in the school. So one of those conversations I have with the superintendent, there will be cases in the schools. So there is no reason to panic about that. It's not because you reduce the distance. We have to look at the evidence. We have to track the path of the virus and then see what contributed to it. And then we continue to monitor every week, every 2 weeks, every month. That's how we modify the policy. And we'll work through with them. And you will know that yourself also.
Doctor, there's a lot of, I think, scientific backing for keeping windows open as a safety measure. Are you recommending
Yes.
this in classrooms and on buses?
Yes, as the spring is arriving, hopefully soon, you know, anytime, one of those things which I certainly communicated to them, whenever possible, if you can open the windows throughout the day possible, that will be great. The same thing is applicable for the buses also. So anytime then you have a ventilation opportunity, please go for it. That helps. Physical education class, if there is opportunity to do it outside as soon as the weather allows, I think those things schools are going to be looking for. Yes, I strongly would recommend that also.
One more time on the buses. It sounds like your general guidance is that kids could sit in every seat, and if the bus ride is short for some of them, they could actually share a seat?
So right, so we are just trying to say that 3 feet we'll try to maintain. If you have a 20 minutes ride, if we are going by the CDC's 15 minutes exposure, so if the kid, as you know that within 1 mile you have to walk, I think, but before that 2 miles, it takes few minutes to come. So you stop there and the kid gets picked up from that spot and then goes and drops off. So could that ride be 5 minutes, 10 minutes? Can we share it? We have to think of a very creative but safe way to make sure that the kids can be transported. If the parents can bring their kids there and work with the school district, those who can, bring the kids there to school, that will be wonderful also. But one thing which we don't want is having many parents, like do the carpool and all those kind of things, because that also defeats the purpose. So that is very crucial that we stick to the public health guidance, which is still continuing. This is very unique to the school situation. And that is something adults will need to, the parents will need to remember. Don't shove all the kids in one car and then next thing you say, we are going to take it all. No, that's no for that. That is very important to remember.
Doctor, one more, I'm sorry. I know I said it was my last one. What would you say to someone or a parent, you said you've gotten emails from both sides. What would you say to a parent who believes that their transmission rate is low because kids are not in school and they should stay out of the classroom? What would you say to a parent?
So we do have, actually we have the data to prove that when we look at the online versus pure online versus the hybrid and in person, no difference. That tells you the story. You don't, data tells you the whole fact essentially. And most of the people who send me information or a plea were that wanted to open it. I think there was one, that person was not even a parent, was somebody who just were pleading that you shouldn't do that, but that was not a parent actually. So the parents of which I have gotten is that one they were saying based on that, please make sure that you do something to work on a policy proposal. So.
Other questions?
At last check, there were over 1,000 vaccine appointments still available. What are you guys doing to try and fill these slots? Are there any other ways you're looking to try and reach people with these slots still open?
For what day?
It was for today.
No, I only think we opened up 500 on list today, right? Or for Tuesday?
Tuesday.
Oh, for Tuesday.
Yeah, for Tuesday.
Yeah,
there were
so,
over 1,000. Yeah.
Yeah, so it's Thursday. We feel good about that one. Again, why we the last 2 days. So just think about this from a logistics process. We're not gonna. Our community at our pod, we've never had to cancel appointments because we wait till we physically have the vaccine. So what changed this week, which was tougher, where it took a little bit longer, the reason why, one, it's taken a little longer is because more people are getting vaccinated. in these eligible groups. But two is there wasn't the type of notice. Remember, previously we all would be here, we'd have 1 or 2 clinics, we would say, on this day around noon, look for the thing, a lot of anticipation. Supply wasn't as great, and so then people knew we're releasing midday when we got the vaccine, I think this Tuesday, about a clinic the next day. And it took a little while, but it all filled up. And then yesterday, I don't think it all filled up, but we'll take a couple hundred of the doses and we'll go target independent living facilities with those. So not a big deal. But moving forward, we do think, though, we'll probably see eligibility loosen up at some point. And that's, I think with our seniors, we're getting very, very close to being able to vaccinate all of our seniors, which is really a big monumental step for our community, because our seniors have bore the brunt of this pandemic, if you think about it, from getting sick, hospitalization, ICU, worse, but also because of the risk, they've had it harder related to socializing and gathering. So the fact that we're making such inroads vaccinating our seniors is something we should all be very happy with.
Do you think the state should start opening up more eligible groups?
I think we're gonna. I'll feel more confident talking about that on Monday or Tuesday or Monday, but I do think we're getting to a lot of folks. Now it's almost like within our senior population, we're having to micro-target, which is a really good spot to be in. Now we're talking about getting our homebound seniors. We're talking about going to independent living facilities. We're getting some feedback from some nursing homes that now want some other employees and residents that are new residents to get vaccinated. So these are things, and I'm not getting the emails, non-scientific polling here. I'm not getting as many emails from seniors saying I tried to get this or that. We're scrubbing through our on list right now, and so many people have gotten the vaccine. So I think we're making real progress here in that category. I know with educators we have, I know with law enforcement professionals we have, and so the members of our communities with comorbidities, we're all making progress on this. So I think we opened up restaurant workers at our own pods. Again, many restaurant workers who we were working with the associations on, they're the same people that we had a list for, they had already gotten the vaccine. And the hotel workers, again, we activated that right when the governor said we could. Again, a lot of these folks are getting the vaccine now. So I do think, in short order, there probably does need to be some more eligibility opened up. That's not our number. That's the state of New York, and I think it's a percentage, right? So I think they probably could have gone a little bit higher, but logistically, today's Thursday. This all got Today's Thursday. This all got worked out in the last 12 hours. So logistically, to get what needs to be done for Saturday, I think that's probably a number the university felt they could meet.
Last month, you said the state should look at positivity rate and not the number of cases less than 24 hours later if the state changes the rule. And now on Tuesday, you said that you didn't understand why the state didn't allow fans into the Carrier Dome, and now today they allow fans back into the Carrier Dome. So I'm not going to call you a prophet or anything, but
I think it's you. Every time you come here, this all happens. So you come every day now, okay? But no, it was the whole thing with the fans and the testing. This is something we've gotten pretty good at, and so we understood. We've been. It's about balance, and again, the state's looking at it from a macro level, the state level. They have parts of the state that still have 4% positive rates, right? In Long Island and New York City. We're a big community. We're not a small community, and we're under 1 or around 1, and we've been there for a while. So I think it was having the dialogue and certainly a good resolution.
And is there anything you would like to see the state do to further, let's say, benefit Syracuse University during this time?
Well, I think right now the two big things, certainly the positive rate was a big deal as far as keeping kids learning, and certainly this is good because it's going to give some of these kids who've never been in that facility, other than probably getting a test, an opportunity to go and cheer on some of their classmates. So I think this is a start, and I think moving forward, when we see regulations that kind of are on a teeter-totter one way or the other, we're going to try to, utilize all of our tools to make sure that we find that balance.
Where are we with getting fences to the War Memorial?
Yeah, so the new guidance, I saw the guidance the governor put out. Not really, I'm going to try to work specifically with the War Memorial or facilities that large. I think he put out for those under 10,000, like 100 people. Look, at the reality is that doesn't work for the War Memorial, right? It just doesn't even, it's not even worth going through the process for 100 people there. If you want to do 10% where you have in testing protocols, that works, but it doesn't work here. And that's what's going to be tough. There's the guidance that people are comfortable with, and then there's the practicality for the industry to work, and then you have to see if there's common ground where you can modify so that the industry can actually perform. And again, I think as we continue to vaccinate, I think you'll continue to see these regulations balance out a little bit better.
Ryan, as you talk to the state about these issues, like the dome or the War Memorial, what role does the control room and Matt Driscoll play in that?
Yeah, I think so. The control rooms is not so much a specific to our county platform. It's a platform for the leaders in the community to share what they're seeing, review data for them, for members of the governor's team to give information. Usually it's about a regulation or a change that the governor spoke about. And then it's an opportunity to bring up issues. And so that's a venue, it's an avenue, and then certainly we have our own avenues as well.
But I noticed that Syracuse University thanked Matt in part for helping to work out the issue at the dome. Was he part of that discussion?
I'm sure they're talking to everybody. Yeah. Yeah.
Do you still have regular calls with that control room?
We do. We do. We usually twice a week.
Ron, you've been very open about your health with a couple different outlets talking about the toll the pandemic's taken on you. How do you feel today? How are things going the last week or two?
No, things are.
Since it came out that we learned what you've been going through.
Yeah, no, things are going okay. And again, I want to thank everybody who sent me. I've gotten a lot of cards and a lot of emails and a lot of folks diagnosing my health situation, which is nice. It's endearing, and I really appreciate it. And it does help. It helps us all through all this. Physically, I feel better. My vision is I'm looking out. Josh, you're kind of all over the place, to be honest with you, right? So,
My normal
so it's getting better, and I feel confident, and I'm taking a lot of my doctor's advice, and I think we're making progress. But with your vision, it's tough. You don't. It's not like you wake up and all of a sudden your vision's back. You think you're seeing little positive steps, and you really don't have that confirmed until you get back in front of your doctor and they go through the same range of tests. But I feel better. A lot of rest. When you can't drive on weekends, there's not much you can do. I get dropped off, and my family kind of locks me in my house. So, I get a lot of rest on weekends now.
Ryan, even though the transmission numbers are so much better in the county, we have had still a steady, usually a daily number of deaths.
Mm-hmm.
And a fair number of those are occurring in nursing homes. Do you have any data on whether those residents had been vaccinated or not?
I don't. So we don't receive really any specifics to the to that resident in that neighbor if they're in a facility. Again, where we will receive specific stuff, but again, it doesn't tell us if they're vaccinated or not, is I believe the resident we lost today, I believe she actually was from a facility but was in the hospital when she passed. And so we'll receive that information, but we don't, as far as the data point, know if they received a first shot and they didn't receive a second shot, or if they received both shots.
Yeah, there's just a lot of curiosity about whether, whether anyone who's getting sick and dying has had one shot or two shots.
Right.
You don't have any of that?
I don't. Dr. Gupta, have you received? No. Other questions?
How many doses of the Johnson & Johnson vaccine are you getting?
1,000 doses of Johnson & Johnson.
And are you going to work with Nascentia to go into homes or hard to reach?
Yeah, so Dr. Gupta is going to work with the home care providers, whether St. Joe's and Essentia, to figure out who we can potentially redirect some of that vaccine to. And then if not, we'll just work it into one of our clinics, and certainly potentially targeting some of the hard-to-reach communities. You know, that's a great outlet. One shot, you don't need to get that second shot back. So, you know, I think it's a great tool to have, and it's great that we'll have it at the state fairgrounds, you know, for a period of time as well. So, again, if you know, people need a shot right now and you're eligible, there's supply. So please take advantage of it.
When you vaccinate immunocompromised people at the on-center, are you still requiring a doctor's note, or are you taking honor system? Or
So there's an attestation now, too, right, doctor? Yeah. So they're attesting to one of the eligible criteria, and/or a doctor's note is always preferable, but there is an attestation at this point, so that process is there. Yeah, not a requirement. And again, Dr. Gupta this week, in addition to anyone with comorbidities who can register online, we worked again with primary care providers this week as well, as we have the last 2 weeks.
when do you said the county workers are coming back into the building, or into the building?
Yeah, so they're, by contract, we have to, anytime we send them home, we have to give certain notice. So we gave notice. You know, we'll work through, supervisors will be able to, in some of the departments, be able to make modifications for folks who have child care issues or health issues. You know, but the overall, you know, we're at a point where in this pandemic for our operation, where the type of work and the type of challenge we're going to have is going to start to shift. We're going to vaccinate this community, and then we're going to be looking at what's going on with the other human service issues in the community, and we're going to need our workforce under the same roof in some cases to be able to meet those challenges. And so that's something that I've said frequently, because the recovery is going to be more than just an economic recovery. Hopefully we'll get a stimulus bill that will replace our lost revenue, so then we can go inject that lost revenue into the economy to do the things in 2020 and 21 we wanted to do that we couldn't do. But in addition to that, the needs of our kids, the needs of our vulnerable, and everybody that have been impacted by this pandemic in different ways is going to be highlighted more when the vaccinations stop. And so we need to prepare for that. Other questions? Thanks, everybody.